Last year, 376 people died from opioid overdoses in Minnesota, and that's a 12% increase from 2015.
Today, state lawmakers and healthcare professionals announced new guidelines designed to cut the risk of opioid addiction. Delane Cleveland joins us now with details. Delane?
Mike and Alex, the new guidelines were developed by a group of healthcare providers, law enforcement, and pharmacists, among others. The guidelines will help medical professionals decide when to prescribe powerful painkillers, how much to prescribe, and how to monitor their use.
Every time I hear that 2 people in Minnesota overdose every single day, I think of those families going through the trauma that my family went through. And after 10 years, it's still there. And so we really need to step up and make sure that families don't have to go through this.
State Senator Chris Eden of Brooklyn Center lost her daughter to an overdose 10 years ago. She was joined by other members of the work group today in Minneapolis for the announcement. The recommended guidelines include prescribing the lowest effective dose and duration of opioids when used for acute pain.
This problem didn't happen in many other countries. In fact, it only happened in America. What was it about our healthcare system that was vulnerable to this? And do we use this as an opportunity to make a change? Because these raises very serious questions about who is really the healthcare industry serving? Is it serving the patient? Or is it serving, well, itself?
Minnesota health officials are encouraging all providers statewide to adopt the new guidelines. Any medical providers who continue to prescribe opioids beyond the scope of the guidelines could ultimately have their ability to serve Medicaid patients revoked.